Well, I give you this headline right here. Hospitals cut beds as nurses call in sick with COVID-19. No, without enough critical workers during the Omicron surge, facilities limit capacity. Now, there's been a huge thing about overcapacity and hospitals and COVID. I give you that because we have right here CNN, Tapper finally discover misleading COVID hospitalization numbers. I'm Grid 7, and let's get into this article right here. For nearly 2 years, and with the midterm election coming up, conservatives and Republicans were vilified as conspiracy theorists for raising questions about COVID hospitalization numbers and when it comes to who was there because of COVID and who just happened to be infected. I do think there does need to be a distinction there. On Monday, CNN and anchor Jake Tapper finally arrived at the scene to ask the obvious questions after CDC Director Dr. Raquel Walensky admitted to Fox News that the number is inflated by upwards of 40%. That's actually quite a lot. Now, if 40% are just happen to be there and have COVID, then if you're saying they're there with COVID, you're actually inflating the number. You're inducing more panic. Tapper prefaced his late reservation by prefacing to CNN Dr. Sanjay Gupta that the case numbers aren't really significant as hospitalizations because what's important is how people are getting sick. And since CNN obfuscated the idea that CNC was misleading people, Tapper had to spell out what was going on. Over the weekend, the CDC director, Dr. Raquel Walensky, was asked how many people are in the hospital for COVID versus how many are in the hospital with COVID, meaning that there are some other reason that they're there and they just have COVID. After playing a soundbite of Walensky admitting up to 40% of the patients who are coming in with COVID are coming in not because they're sick with COVID, but because they're coming in with something else, Tapper seemed a bit surprised and called it misleading. That's because it is misleading. If you're reporting 100 people are in the hospital with COVID, people automatically assume they went to the hospital because of COVID. But if only 60 people went in because of COVID, no, you're giving two different numbers. They go, so the hospitals are still stretched because of this. So I'm not trying to take away from that. But if 40% in some hospitals, 40% of the people who have COVID don't necessarily have problematic COVID. They're there because they got into a car accident. They're there because, they bumped their head and they're being included as in the hospital with COVID. That number seems misleading. Yeah, and people like you, Tapper, don't question because you literally have an agenda. Gupta deduced that Walensky was possibly using the numbers from New York State because it sort of tracks with what she said, and that according to Gupta's recap of the data, about 57% of those are COVID patients admitted because of or complications from COVID, 43% admitted for other reasons and then diagnosed with COVID. I think there needs to be transparency about that in terms of for or with COVID. And they're just now getting around to doing this distinction. Now, this should have been something been done for a year, in my opinion. But let's face it, if they say 100 people are in the hospital with COVID, it sounds better for the news and the fearmongers. Going on, by the end of the segment, Tapper seemed a little irked by the CDC's inflated numbers. And we need to get the clearest picture possible. If somebody's in the hospital with a broken leg and they have asymmetric COVID, that they should not be counted as hospitalized with COVID clearly. Yes, this is something that should have been done months ago. I said beginning of the year type thing. This comes a day after CNN's media apologist, Brian Stetler, decried the media and doomsday doctors for spreading panic porn about COVID. And now they've realized there's a lot of lying going on. Maybe they'll have a clue and look into other stats as well. I don't think that they'll actually do that, because the media. Now, if you take a look, now there was a CBC journalist just a couple of days ago that said the media has an agenda, and if you are not part of that agenda, you're vilified. Now, you don't ask questions, and this is the COVID number is one of those things where you don't question. People are now questioning more and more, but now what do you think? Misleading? Is the media finally maybe catching on? I don't know. I don't have my hopes up about it. Let me know what you think. Give a like, comment, subscribe, and I'll see you next video for the next article. If you have an article that you see, let me know.